U.S. coal power plants killed 460,000 in 20 years, claims new study. PM 2.5 from coal is much more harmful than we thought, and its mortality burden has been seriously underestimated. Researchers at George Mason University, University of Texas at Austin, and Harvard T.H. Chan School of Public Health have uncovered a startling revelation about the deadly impact of coal-fired power plants on our health. The study breaks previous notions by indicating that exposure to coal PM 2.5, microscopic air pollutants released during the combustion of coal, poses a mortality risk 2.1 times higher than PM 2.5 pollutants from other sources. A lethal legacy. PM 2.5 from coal has been treated as if it's just another pollutant. But it's much more harmful than we thought, and its mortality burden has been seriously underestimated, said Lucas Hanman, co-author of the paper and an assistant professor at George Mason University, in a statement. The researchers attribute coal-burning power plants to have caused an estimated 460,000 deaths in the United States between 1999 and 2020, with each plant being responsible for at least 5,000 deaths. The team used publicly available data tracking emissions from 480 coal power plants and factored in wind direction and the reach of toxins from each plant. This data was then cross-referenced with Medicare records amounting to 650 million person-years of Americans aged 65 and over. The data revealed an alarming observation. A 1 microgram per cubic meter increase in annual average coal PM 2.5 was associated with a 1.12% rise in all-cause mortality, marking a mortality risk 2.1 times greater than PM 2.5 from other sources. The study also highlighted regional disparities, with industrialized states such as Ohio and Pennsylvania experiencing a higher concentration of coal-related deaths. However, every region was found to house at least one plant linked to 600 deaths. The study brings a ray of hope, indicating that the rate of deaths has significantly decreased in recent years. From an average of 43,000 deaths per year between 1999 and 2007, the number dropped to 1,600 annual deaths by 2020. This positive trend, a result of regulations on burning coal and adopting technologies like scrubbers in coal plants, showcases the impact of environmental policies on public health. These findings can help policymakers and regulators identify cost-effective solutions for cleaning up the country's air, for example, by requiring emissions controls or encouraging utilities to use other energy sources, like renewables, said Hanman. A call for action. While coal use has declined in the U.S., more than 200 coal-fired power plants still operate, accounting for 20% of electricity generation in 2022. As countries debate their energy sources and as coal maintains a powerful, almost mythical status in American energy lore, our findings are highly valuable to policymakers and regulators as they weigh the need for cheap energy with the significant environmental and health costs, said Francesca Dominici, a professor of biostatistics, population and data science, and co-author of the study. The study calls for urgent action to reduce reliance on coal and accelerate the transition to cleaner, more sustainable energy sources. While coal use has decreased in the U.S., it is still short of the complete shift towards cleaner energy alternatives necessary to safeguard public health. The team's findings were published in the journal Science. Study abstract. Policymakers seeking to limit the impact of coal electricity generating units, EGUs, also known as power plants, on air quality and climate justify regulations by quantifying the health burden attributable to exposure from these sources. We defined coal PM 2.5 as fine particulate matter associated with coal EGU sulfur dioxide emissions and estimated annual exposure to coal PM 2.5 from 480 EGUs in the U.S. We estimated the number of deaths attributable to coal PM 2.5 from 1999 to 2020 using individual-level Medicare death records representing 650 million person-years. Exposure to coal PM 2.5 was associated with 2.1 times greater mortality risk than exposure to PM 2.5 from all sources. A total of 460,000 deaths were attributable to coal PM 2.5, representing 25% of all PM 2.5 related Medicare deaths before 2009 and 7% after 2012. Here, we quantify and visualize the contribution of individual EGUs to mortality. Thanks for watching.